After 70, a man faces many silent battles. Some you talk about, aches in your back, forgetfulness, loss of appetite, but others you keep buried. In the quiet of the night, when everyone's asleep, you feel the weight of aging, not just in your joints, but in your identity. One of the hardest truths? Your masculinity feels like it's fading. You start to question, am I still the man I used to be? Your energy isn't the same. Your desires shift. And sometimes the most personal part of who you are, your penis, feels like a stranger. But let me tell you something powerful. Your manhood doesn't expire with age. It evolves. It's not about chasing youth. It's about understanding your body, respecting it, and caring for it with the wisdom only time can give you. The truth is, your penis, just like your heart, your lungs, and your mind, requires essential, intentional care, especially after 70. And this isn't just about sex. It's about dignity, confidence, health, and the deep connection between your identity and your body. What you'll hear in the next few minutes might surprise you. It might even challenge some old beliefs. But it could also change the way you live out the most important years of your life. These are 5 essential things every man must know and do for his penis after 70. And trust me, this isn't about vanity. It's about vitality, strength, and reclaiming control over something that still defines a piece of you. Stay with me, because the man you are isn't gone. He's just waiting to be awakened again. Number 1, prioritize blood flow, the lifeline of male vitality. After 70, the silent enemy of your penis is poor circulation. Your erections, dependent on it, your sensitivity, driven by it, your ability to feel alive, all tied to blood flow. Here's the truth most men ignore. Erectile dysfunction isn't just about sex. It's a red flag. It's your body telling you, hey, your pipes are clogged. The arteries in your penis are small. If blood isn't reaching them, you might be at risk for bigger issues, like heart disease or stroke. A Harvard study once revealed that men who struggle with erections are 50% more likely to suffer cardiovascular events. Why? Because the same plaque that blocks your heart can block your groin. Your penis is the canary in the coal mine. So what do you do? First, get moving. Even a 30-minute daily walk increases nitric oxide production, the molecule that helps blood vessels relax and improve blood flow. Second, ditch processed foods and sugar. They stiffen your arteries and steal your manhood slowly. Add leafy greens, beets, and pomegranates to your diet. They're nature's little blue pills. Also, don't ignore the power of deep breathing and meditation. Chronic stress kills libido by shrinking blood vessels. When you calm your nervous system, you improve vascular health. And here's something bold. Talk to your doctor about low-dose PDE5 inhibitors like Cialis if approved. Studies show they can improve endothelial function, not just erection quality. This is about more than performance. This is about circulation, cellular health, and living fully. Remember, your penis isn't failing you. It's asking for help. Listen to it. Help it help you. Number 2, master hygiene. Like your health depends on it, because it does. Most men over 70 don't realize that the hygiene habits they used in their 30s don't cut it anymore. Your skin thins, your immune system slows, your body's natural defenses weaken. What does this mean? Infections and irritations become more likely and more dangerous. Something as simple as a buildup of smegma or infrequent washing can lead to inflammation, odor, fungal infections, or even more serious issues like balanitis or phimosis. If left unchecked, chronic infections can even raise your risk of penile cancer. It sounds harsh, but it's the truth many avoid. So here's what you need to do. Clean gently but thoroughly. Use warm water and mild unscented soap. Avoid scrubbing harshly. That causes micro tears and irritation. If you're uncircumcised, retract the foreskin fully and clean underneath. Then dry it completely. Moist environments breed bacteria. Next, inspect. Once a week, take a moment to examine your penis. Look for unusual bumps, discoloration, or changes in texture. Be your own health advocate. If something doesn't look or feel right, don't wait. Also, use cotton underwear. No synthetic fabrics that trap moisture. And when using public restrooms, always clean yourself properly after. This isn't about being paranoid, it's about being proactive. Lastly, apply a light moisturizer, preferably one with aloe or vitamin E. It keeps the skin supple and prevents dryness or cracking. Hygiene is not just cleanliness, it's self-respect in action. You're not just cleaning your body, you're honoring it. And that's a powerful thing. Number 3, understand testosterone, your masculine fuel. Here's the brutal truth. After 70, your testosterone levels are in free fall. And most men have no idea how that changes not just their body, but their mood, their sleep, their focus, and yes, their sexual health. Low testosterone doesn't just steal your libido, it steals your drive, your confidence, your sense of self. One study from the Journal of Clinical Endocrinology found that men over 65 with low testosterone had a higher risk of depression, cognitive decline, and even early death. That's not just about sex, that's about life. So what can you do? Start with lifestyle. Weightlifting, especially compound exercises, boosts natural testosterone. Get 7 to 8 hours of sleep, as testosterone production happens during deep REM cycles. Eat zinc-rich foods like pumpkin seeds, oysters, and lentils. Cut out alcohol and processed soy. It mimics estrogen and throws your hormones off balance. Second, get your levels tested. Don't assume this is just normal aging. Many men are walking around in a hormonal fog and blaming themselves. If your levels are low, talk to your doctor about TRT, testosterone replacement therapy. It's not for everyone, but for the right man, it can feel like flipping a light switch back on. More energy, more clarity, more vitality. But don't go chasing youth. Chase balance. Because testosterone isn't just a hormone, it's your masculine signal to the world. Nurture it, don't ignore it. Number 4, don't ignore urinary health, your body's hidden alarm. Frequent urination, weak stream, that lingering sense that you haven't fully emptied your bladder. Sound familiar? These aren't just old man problems. They're urgent signs your prostate and urinary system need attention. The prostate, a walnut-sized gland, tends to enlarge with age. This benign prostatic hyperplasia, BPH, can press against your urethra, affecting your ability to pee, your sleep, and even your erections. More than 50% of men over 70 experience some form of urinary dysfunction. But here's what most don't realize. Ignoring it leads to serious consequences: bladder damage, kidney problems, and even infections that spread to the bloodstream. What should you do? First, monitor your symptoms. Use the IPSS, International Prostate Symptom Score, checklist to understand how severe your issues are. Track changes over weeks, not days. Second, limit caffeine and alcohol. They irritate the bladder. Stay hydrated, but not too close to bedtime. And avoid holding urine too long. It weakens the bladder muscles over time. Third, consider natural aids like saw palmetto, beta-sitosterol, and pygum, which support prostate health. But always consult your doctor first, especially if you're on other medications. Lastly, get your PSA levels checked annually. Prostate cancer, when caught early, is highly treatable. Waiting because of fear is not stoic, it's reckless. Taking care of your urinary health is not about being scared. It's about being strategic. Your body whispers before it screams. Listen closely. Number 5, protect intimacy. It's not over unless you let it be. Here's a truth too few speak aloud. Aging doesn't mean the end of intimacy. It simply means it must evolve. After 70, erections may take longer. Sensitivity may lessen. But that doesn't mean you're done being a lover. In fact, these years can bring a deeper, more profound kind of closeness, one rooted in emotional connection and intentional pleasure. Many men silently mourn the loss of spontaneity, feeling like they're less of a man. But that's not weakness. That's a sign you're adapting, and that takes courage. So how do you protect your intimacy? First, talk to your partner. Honesty is sexy. Vulnerability creates space for new forms of pleasure. Learn to slow down. Explore each other without expectation. Focus on connection, not performance. Second, consider using lubricants to ease discomfort. Dryness is common for both partners. Using assistance is not a defeat, it's a sign of devotion. Third, educate yourself on arousal after 70. It's less about quick heat, more about building emotional safety and trust. Try massage, skin-to-skin contact, and prolonged foreplay. Fourth, explore safe options if needed. Vacuum pumps, ED medication, or even pelvic floor exercises. These aren't shameful, they're tools. Finally, let go of outdated definitions of sex. Intimacy doesn't have to mean penetration. It can mean closeness, laughter, being present. Your penis may have aged, but your capacity for love, touch, and connection has not. Don't surrender this part of yourself. Nurture it, own it, live it. Conclusion. Growing old is not a punishment, it's a privilege, but it comes with responsibilities, especially to yourself. Your penis is not just a piece of anatomy, it's a mirror of your life force, your health, your sense of identity. To neglect it is to silently retreat from the power you still hold. And make no mistake, you do still hold it. You've lived decades. You've built, loved, lost, rebuilt. Don't let these final chapters be written in silence or shame. Take charge. Be the man who doesn't hide from truth, but meets it head-on. Let's recap what we covered. 1. Blood flow is your lifeline. Protect it. 2. Hygiene is self-respect. Master it. 3. Testosterone is your masculine fuel. Balance it. 4. Urinary health is your body's warning system. Listen to it. 5. Intimacy isn't over, unless you walk away from it. So what now? Start today, one small change. One honest conversation, one checkup, one walk. You're not broken. You're just becoming the man who sees clearly and acts wisely. If this message hit home, subscribe, leave a comment, and share this with someone who needs to hear it. Don't keep this wisdom to yourself. You're not alone in this journey. You're not fading, you're refining. And the world still needs your fire.